Welcome, San Diego Electrical Health and Welfare Trust Medicare beneficiaries. The Trust is proud to now offer Sharp Health Plan's Direct Advantage Medicare HMO effective January 1st, 2023. Sharp Health Plan is among the best. We are a local, regional, commercial plan, highest member rated in the state of California. We're local, personalized. Everything we do is for the San Diego community. So why is Sharp Health Plan's Direct Advantage Medicare HMO now being offered to Medicare beneficiaries effective January 1st of 2023? So if you look at the structure right now, when you become Medicare eligible, your only option to choose if you're staying within the trust is Kaiser. So the majority of the trust currently has Anthem's PPO, and the trust wanted to make sure that anybody with Anthem's PPO, as they get to early retiree status, they now can transition to Sharp Health Plan's early retiree HMO. And then once they go into Medicare A and B status, you will now have Sharp Health Plan's Direct Advantage Medicare HMO to choose from. Because the current offering only allows you to transition to a Kaiser plan, which means that the majority of Anthem folks are going to lose their doctors and providers. And specifically, why Sharp Health Plan? Again, because the majority of all Anthem PPO subscribers are currently going to Sharp providers right now. So it was a natural transition to be able to continue that down the road and offer the Direct Advantage Medicare plan. So although we will be offering the Direct Advantage Medicare medical benefit plan, Sharp Health Plan will not be administering dental. Okay, Delta Dental will still remain available to you through the trust, but there will be an additional cost if you want to enroll in that. Keep in mind as well that through Sharp Health Plan's Direct Advantage Medicare plan, we do have a network of mental health and substance abuse services and providers that you would need to choose from. So if you do enroll into the Direct Advantage Medicare plan, you would no longer have the Optum network of mental health and substance abuse providers. So this is a screenshot. It shows the Sharp Health Plan Direct Advantage plan alongside the Kaiser Senior Advantage plan. So there's no deductible. The out-of-pocket max is the same. You can see here that the primary care physician visit with Sharp is $5 versus Kaiser $10. Specialist is the same. And again, we are an HMO, so you would choose a primary care physician that would need to refer you to specialists. Urgent care center is the same. And then we do provide acupuncture and chiropractic benefits that you can self-refer. You don't need to go through your primary. We use American Specialty Health Plan. And you can self-refer, and you have 30 visits per calendar year. All lab and x-ray are a zero copay. Advanced radiology, that would be CAT scans, PET scans, MRI. There is a $20 copay for radiology. And then hospitalization is unlimited, meaning you cannot use up the day amount of hospitalization. Your per admission cost, regardless of what the true cost of the hospitalization is, would be a $50 copay. If you do have outpatient surgery, again, there's a $25 copay. Emergency room coverage is worldwide, meaning you can go to any emergency room in the world. If you are treated and released, you're responsible for a $50 copay, no matter what the actual cost is. If you are admitted to the hospital, the $50 is waived, and then you're only responsible for the hospitalization copay. Hearing aids, a very generous allowance of $3,500 every 36 months. And then the retail prescriptions, you see quite a few figures and numbers. That's because there are different levels. There are approved generic tier 1, generic tier 2. There's formulary brand. Then there's brand that is not on our formulary list. And then there are specialty meds. So there's two ways that you can receive your prescriptions. You can do a retail prescription, which is a 30-day supply at a local pharmacy, and we contract with all the major pharmacies. So CVS is our pharmacy benefit manager, but at a retail level, you can go to CVS, Rite Aid. A lot of our Sharp facilities have pharmacies right in the same building. Costco, Target, Walmart, Walgreens. We're contracted with all the major retail pharmacies. And then on a mail order prescription, you can see here, we give a 90-day, 3-month supply, and that is through CVS Caremark. So the Sharp Direct Advantage Network, again, this is an HMO. So you would choose a primary care physician within a medical group who would refer you to specialists within that medical group. And on the right-hand side, you can see the major medical groups, Sharp Reese-Steely, and then Sharp Community Medical Group, Central San Diego, and then North County, Arch Health Partners, and Graybill, whether Inland North or a little bit towards Coastal, plus Tri-City IPA. So you would choose your medical group and a primary care physician within that medical group who would refer you to specialists. The hospital, that depends on the specialist and their admitting privileges of where you would be admitted for a scheduled hospitalization. And then there's over 400 plus pharmacies. There's a smattering on the left. Urgent care center, while you are in San Diego, you must go to an urgent care center that is contracted with your medical group. So make sure that you review. You can go to sharphealthplan.com and look up the urgent care centers, because Sharp Reese-Steely has different urgent care centers than Sharp Community Medical Group. And then we provide CVS Minute Clinic access nationwide to all members, no referral necessary. So we have you covered in a variety of different ways. We talked about primary and specialty, hospital and emergency, urgent care, the CVS Minute clinics. In the middle, I just do want to call out that through Sharp Reese-Steely and Sharp Community Medical Group, video visits and telehealth are available at the applicable copay. We do have after hours nurse access care availability if you want to speak to a nurse Monday through Friday, 5 p.m. to 8 a.m., and then 24 hours on the weekend. We have our member portal, as well as our health coaching and telephonic coaching through our Best Health and Wellness program. So speaking on the right-hand side of our wellness program, for those of you that are into fitness, there's a wonderful Silver and Fit program that has discounts for gym memberships. If you are into vitamins, herbs, supplements, there's discounts available. There's health coaching for things like smoking cessation, weight management, stress management, cardiac care, nutrition tips. There's a full library on wellness. There's so many things to take advantage of on the wellness program. So please make sure you go to the portal and review everything that's available to you. And then if you like to travel, we have our Global International Assist America plan over the border of Mexico internationally or 100 miles from your home. They will assist you in coordinating hospital admission, urgent care, things like compassion visits, if you need to be medically transported, return of mortal remains. Some of these things aren't fun to talk about, but the nice thing is you are covered. So they would assist in coordinating and also making sure that the expenses are picked up other than your cost share. Follow My Health, for those of you that are already with Sharp. At the Sharp provider level, this would be your own private, secure member portal where you can email your physician and schedule appointments, receive messages, pharmacy refills, view any lab radiology results, urgent care visits. Everything to do with your healthcare will be cataloged in your own personal private Follow My Health portal. And then you also have your member portal that's available via your phone, tablet, desktop. On the right-hand side, you can see there's a variety of things that you can do right at the touch of your fingertips. So take advantage of reviewing your benefits, updating your physician, contact information, getting a soft copy ID card. So many things that you can do now right from the comfort of your own home. So what do you need to do next? When you want to go ahead and enroll in Sharp Health Plan, the Direct Advantage Medicare plan, you can call the trust via the phone number or email that's right here on the screen, or download the application right from the website. So a couple of things is that you are considered the beneficiary, as is a spouse in your household is considered a beneficiary. In order to enroll, you must have Part A and Part B of Medicare. Each household member has to fill out their own application, even if they are the spouse and did not work for the Electric Health and Welfare Fund. Your Social Security number has to be entered. We have to verify your Medicare benefits, okay? So early retirees or spouses that are aging in can enroll, and one can enroll before the other because you may have a spouse who becomes eligible before you. And then if you have any questions, you can contact the trust. They can also send you a Medicare enrollment kit plus the application. And you also need to choose your primary care physician. Please do not put the name of the physician, but you'll need to get their 10-digit code. And how do you do that? Well, you can go to sharphealthplan.com/find-a-doctor. And I know it says here Select Performance Network, but it's actually the Direct Advantage Network. So you'll see the Direct Advantage Network on the drop-down box, and then you can search by zip code or mile radius. And next to the doctor's name will be a 10-digit code. That's what you'll enter on your enrollment application. Again, we are not providing dental coverage, so if you want dental, you'd need to enroll in Delta Dental with the trust. And then you're going to mail back the application, either mailing it the old-fashioned way or emailing it, and the information of where to send it is on the right-hand side. So please remember, if you're enrolling in the Sharp Health Plan Direct Advantage Medicare plan, you need to fill out your Sharp Health Plan enrollment application. So 2 months prior to your 65th birthday, you should receive an enrollment kit from the trust administrator. If you have not received the kit, you can reach out to the trust administrator's office. In the previous slide, we provided the phone number, we provided the email, and Kelly Novak is your contact at the trust office, and she will go ahead and send everything to you. Remember, to enroll, you must have Part A and Part B of Medicare. And you can enroll any time of the year, so you don't have any particular open enrollment. This is just as you age into Medicare and get your Part A and Part B, you are eligible to enroll. And then each household member enrolling must fill out their own enrollment application. So if you or your spouse are both turning 65 and you're both getting A and B, and you're both going to enroll into the Direct Advantage plan, each person needs to fill out their own individual enrollment application. So thank you so much for your time, for your consideration. We look forward to welcoming you to the Sharp Health Plan Direct Advantage Medicare plan, now being offered through San Diego Electrical Health and Welfare Trust Fund. Again, thank you and have a wonderful day.